According to the 2022 United States National Survey on Drug Use and Health, they say 46.8 million Americans aged 12 and older battled a substance use disorder in the past year. Genetics, it's what makes us individuals. It's what makes you, you. Well, what if genetics has a role in addiction? Hello, my name is Vincent Zufelt, and welcome to my TED Talk. The question I came up with to guide me throughout my research was, to what extent does genetics play a role in addiction? I chose this topic because I took a class my sophomore year called Addictive Psychology, and it intrigued me. But I also have a personal connection to this topic. Addiction runs within my family, on both my mother and father's side. Before I was born, a family member of mine was cooking, selling, and using meth within my own house. A big portion of my family has tried nicotine, or has been addicted to nicotine, and most of my family has at least tried it. A couple of my cousins have been born with a disorder because of drug use while pregnant. And I also have a couple of great-grandparents, cousins, and uncles who suffered from alcoholism. Now, the current research we have on genetics and addiction is complex, so they can be defined separately from one another. Genetics, as I said, it's what makes us individuals. It's our DNA. It's what makes it to where I can never be the same as someone else, and they can't be the same as me. And it also connects us to past relatives. Addiction is classified as a disease, a compulsive feeling to use or do something that a lot of the time is related to drug use, giving a physical and psychological dependence towards the drug of choice. A lot of the times, if you were to use and become addicted and then try and quit, you'll experience withdrawal symptoms, which can look different for multiple different types of drugs. For example, nicotine, you start to shake a lot, and people who smoke cigarettes or e-cigarettes get into the habit of putting their fingers towards their mouth because they are smoking. And it makes it difficult for people to quit because they're constantly moving their hands and moving their mouth and doing something. So a lot of the times, people who are trying to quit nicotine choose to chew gum or eat seeds because they're constantly moving their hands and moving their mouths. There's a lot of roles that play into addiction, and some big ones are dopamine and serotonin. So what is dopamine and serotonin, and how do they both work? Dopamine and serotonin have a bunch of similarities, but they also have significant differences. Something they both have in common is they give people the feeling of happiness, but they also work similarly when it comes to the synapse system. So you have the axon terminal, which is this big bone-looking thing right here, which helps send signals to other cells using the neurotransmitters, which are these little black balls right here, which are dopamine and serotonin within the synaptic vessel, which is the little circles that are inside of it. They are then released into the synaptic cleft, which is where you feel your feelings of happiness, but it also, the neurotransmitters sent into the synaptic cleft get recognized and modulated to find out if the body needs to increase or decrease the duration of neurotransmitter signals, or even add more signals. Then they pass through the receptors to the other axon terminal by entering the receptors, where they will be reused to keep sending signals throughout your body. Now, dopamine is mostly in charge of the brain's reward system, motivation, pleasure, and reinforcement of behaviors, while serotonin is in control of mood regulation, sleep-wake cycles, appetite and digestion, cognition, pain perception, and regulation of blood pressure. Now, dopamine's connection to addiction is pretty simple when you use a drug or do something that takes over your reward system, which is something your brain has in place, that gives you a certain amount of dopamine when a task you've done is completed, which gives you a sense of satisfaction, and it creates a desire to keep completing tasks that give you satisfaction or a certain amount of dopamine. That creates good behaviors. And when a drug hijacks this system, it releases an above average amount of dopamine that your brain, after a while, or almost immediately, it depends on what the drug is, reacts to this and starts to release a abnormally low amount of dopamine to what it naturally originally was. And then this makes your average amount of dopamine lower, which will make your body want more of whatever drug it was that made your dopamine spike in the first place. And according to the National Library of Medicine, the dopamine mesolimbic motivation reward reinforcement cycle reigns the most coherent psychological theory in addiction. Now, genetics can significantly affect dopamine function, affecting certain behaviors and cognition. Stated again by the National Library of Medicine, one possible explanation of our findings is that increased synaptic 5-HT coupled with increased 5-HT3 receptor responsiveness may result in enhanced dopamine transmission in the reward pathway, a predictor of increased risks for addiction. Now, the 5-HT is an abbreviation for 5-hydroxytryptamine, which is another way of saying serotonin. Now, with serotonin and its role in addiction, it isn't as prominent as dopamine's role in addiction, because it has more of a relationship with the reward system creating a longer lasting effect, whereas dopamine creates a more temporary feeling of happiness. Now, that's not saying serotonin doesn't play a role in addiction. Its role is more in the effect on mood regulation, since one of the many things serotonin does is control your mood. Now, if tampered with by a drug, it can cause disruption in the way it's supposed to work, causing depression and anxiety. If there was a change in serotonin levels, it can cause the development of cravings for whatever drug you used that originally messed up your serotonin. Serotonin is also in charge of impulse control and decision making. And people with a lower level of serotonin show a lack of impulse control and decision making. And if people were to use and their serotonin levels get low, they could be prone to, again, a higher risk of poor decision making and bad impulse control. There are main substances that can be prone to high risk, There are main substances that can alter your serotonin levels, like alcohol, cannabis, cocaine, opiates, and amphetamines. According to the Walker Center, frequent abuse or any or all of the substances on this list can result in addiction. Once addicted, the user will experience intensely unpleasant feelings of withdrawal if they stop suddenly. The reason for this is that their brain, now accustomed to producing pleasurable sensations only in the presence of substances, stops rewarding them. Now, serotonin's connection to genetics is similar to dopamine in some ways, affecting mood, again, and behavior. As said in the National Library of Medicine, the SLC6A4 gene encoding serotonin transporter 5-HT has been associated with alcohol dependency risk and differential treatment responses. The SLC6A4 gene is a serotonin transmitter, and its job is to terminate the action of serotonin in the extracellular space. Now, epigenetics is also something that needs to be addressed to further knowledge on the topic. Epigenetics, explained by the National Institutes of Health, epigenetics is defined as the heritable and possibly reversible modification in gene expression that do not involve alterations in the DNA sequence. I think of epigenetics as a light switch that can be turned on and off depending on your environment. And understanding epigenetics can help understand its role in health and disease. There was a study on twins that the National Institutes of Health wrote about, saying twin studies have revealed that there are common heritable genetic components that predispose an individual to drug addiction, and that these genetic factors contribute approximately 20 to 50% to the variance of developing a drug addiction, with the remaining contribution due to non-genetic factors. And another study that the National Institutes of Health wrote on was recent studies have revealed the role of gene-environmental interactions which occur when genetic factors interact with the environment to influence behavioral phenotypes. For example, several studies have focused on the 5-HTTLPR variation in the promoter of serotonin transporter SLC6A4 gene, which codes for the serotonin transporter, a target for cocaine and meth. To basically sum up what they said, the 5-HTTLPR decreases serotonin uptake and serotonin transporter expression. The 5-HTTLPR is thought to find out if individuals are predisposed to certain disorders such as anxiety and depression. Now, does any of this information matter to you? Why is this information even, why should you care? Why do you need to know? It's something that could impact all of us and further generations. More and more research on this topic keeps coming out. it might actually prove my answer to this question correct. And genetics do have a strong impact on addiction. If it's true, we could all have something within our genetic code that is more susceptible to addiction. Finding more information on this topic, we might be able to find what specific genetic code someone has that is more susceptible. That person can then prepare or completely avoid doing something that could lead them to becoming an addict. Now, all this information given today is related to my topic in some way, but they didn't give me a yes or no answer to my question, to what extent does genetics play a role in addiction? It gave me more of an understanding of what dopamine and serotonin are and what their roles are in our day-to-day lives, and then what epigenetics is and how it relates to addiction. This topic is a newer topic that not that much research has been on, but it's started. The research we have on this topic is being published in multiple different articles, and they're all saying they're saying the same thing, just in different words, and it's all still inconclusive. They're finding more and more information that I believe in time will give us a confident yes or no answer to my research question. But from the research I've done and what I've said today, I say yes, genetics do play a role in addiction. Because of the information provided by epigenetics when it comes to disease prevention, diagnosis, and treatment, if we were to find a way to connect these genes and hereditary addiction, we could find a way to predispose someone that could have a higher chance of becoming addicted to a specific drug because of the gene they have being defected or below the average. Thank you for listening to my TED Talk.